Dear all, my name is Julia Hanevelt. I am a clinical researcher in the colorectal research group of Isela in Zwolle, the Netherlands. We collaborate closely with the University Medical Center Utrecht, where the Dutch T1 working group is based. This initiative was established under the leadership of Dr. Moons, who is also the senior author of the study I would like to introduce to you, entitled Trends Over Time and Interhospital Variation in the Primary Treatment Approach for T1 colon carcinomas in the Netherlands. This study would not have been possible without the close collaboration with the Netherlands Cancer Registry, in particular the assistance of Felice van Erning. Nowadays, we know that especially in low-risk T1 carcinomas, the risk of lymph node metastases is very low, and therefore performing a full lymph node dissection offers no real oncological benefit and definitely does outweigh the significant risks of surgery. That's why the Dutch guideline recommends a local resection first in all cases, and only discussing additional surgery if there are high risk factors for lymph node metastases present. By following this strategy, patients are less often subjected to unnecessary surgery and the risks that come with it. In this study, we aim to investigate in a large nationwide cohort of T1 colon cancer patients to what extent primary surgery was chosen versus a local resection first. We examine changes over time, variation between hospitals, and its impact on overall survival. In total, we included 9,650 patients from 73 hospitals in the Netherlands, all who were diagnosed with a T1 colon carcinoma between 2015 and 2022. We observed that since 2018, there has been a clear increase in local resections. Before 2018, approximately half of the patients received local treatment, but by 2022, this proportion has risen to around 70%, with a decline in the use of primary surgery. The adjusted relative risks for local resection varied across the hospitals. Based on their relative risks, hospitals were categorized as having a low, average, or high attitude to perform local resections first. Hospitals with a high attitude towards local resections ended up doing fewer surgeries overall, but this didn't harm the overall survival rates of their patients. Also, when we looked at patients treated before 2018 and those treated after, overall survival rates were similar. So in conclusion, this study shows that on a nationwide basis, local resection is increasingly being chosen as the primary treatment for T1 colon cancer, without affecting overall survival. However, variation between hospitals exists. We recommend discussing polyps with potential for invasive cancer in a multidisciplinary team meeting to determine the estimated depth of invasion and best suited primary treatment. If certain advanced local resection techniques are not available, patients should be referred. Many thanks for reading our article and watching this video. If you have any questions, please feel free to contact us. Thanks.